Thank you for this opportunity to present again at this Westcoast Hackathon this year, 2022. Breast cancer is one of the leading causes of cancer-related deaths among women in Ghana. In fact, when you look at 5-year survival rates in sub-Saharan Africa, it's about 35%. But when you look at high-income countries, it's about 80%. There is a huge disparity. To improve breast cancer outcomes, we have to be able to detect these cancers earlier. We have to make sure that cancers can be diagnosed correctly and that the patients are able to receive proper multimodality treatment as early as possible. This is a picture of a breast cancer survivor in Ghana, which is actually much more rare than you would like to see. When we look at the factors that affect utilization outcome, we have to realize that just the decision to seek care can be affected by socioeconomic and cultural factors, but it's also related to the accessibility of the facilities and even the quality of care. And then patients sometimes have a hard time just even identifying and reaching a medical facility that can provide the quality of care that we want to provide. This is especially true for breast cancer. At the Center for Global Surgery at the University of Utah, we studied some of the barriers to timely presentation of patients with surgical conditions at the Tamale Teaching Hospital, which is up north in Ghana. And we found that one of the most common causes for a delay in care was initially they would seek treatment at the nearest facility, but that facility didn't provide the services that they needed. Wouldn't it be wonderful if patients knew which facilities they could get the treatment? In looking to expand access to breast cancer care in Ghana, we must first understand where services are available in the country. And these services include screening services, diagnostic services, and treatment options, including surgery, hormonal treatment, chemotherapy, radiation therapy, and even palliative care. But nobody really has known where those services are, what services are available. The NCCN guidelines have guidelines for resource-poor areas or resource-constrained areas of the world. And they have these in basic guidelines, which you can see here include screening and clinical diagnosis, pathological confirmation of imaging, surgical treatment, and non-surgical treatment. And you can see the types that fit into those categories. When you go to a level 2 center, you might find that some of these resources increase. You'll notice here that those things that are underlined are the things that are added to the level 3 to make this a level 2. And when you look at level 1, again, the underlined areas are added to what was there at level 3 and level 2 to make this level 1. You note here, level 1 is where we have a mammogram machine. So where are these services? The Center for Global Surgery initially did a pilot study in the eastern region of Ghana, looking at 34 hospitals. All but one hospital participated, and be able to identify which hospitals might have access to comprehensive breast cancer services, even basic breast cancer services. And we found none of the hospitals actually reached level 1 or 2 or 3. So we developed level 4, 5, and 6 to help us really understand what services are available and can we begin to develop interventions that can take one level to the next level and provide better services. As we looked at this, what would happen if we took just for diagnosis and added one single resource to targeted hospitals within this eastern region? And we thought that we could take 64% of the population that has access within 25 kilometers of care for diagnosis to 74% of the population, again, just by adding one single resource. But how do we do that? Is that possible? What is the rest of the country like? So we went ahead and analyzed the rest of Ghana in terms of what breast cancer services are provided. And we were able to analyze 329 hospitals. There's only 15 hospitals. A couple that didn't participate, a couple we couldn't find, but a majority of hospitals, over 90%, participated in this survey. And we were able to then look at what services were available in surgery, hormone suppression, radiation therapy, chemotherapy, and palliative care. and combine this to see which ones might have basic or even comprehensive services. As we look at Ghana in total, there are only 2 stars on this map that indicate hospitals that have level 1 treatment for breast cancer, a country that has nearly 30 million people. There are several hospitals that meet the level 3 treatment options. And this, you'll see the rings that go out from these areas is the population within that area that is able to be reached within a timely fashion. So the real question for this hackathon, we now have all this data about all the hospitals. How do we go ahead and use that information to make a change for breast cancer care in Ghana, where the stage of breast cancer is usually stage 3 or 4. How do we get that so we diagnose it at stage 1 or 2 and increase survival and have a better outcome? So how do we use this comprehensive analysis of breast cancer services in Ghana? If you had this data set, what would you do to develop and implement a strategic plan to improve earlier diagnosis and provide treatment for breast cancer throughout Ghana? We look forward to ideas that you come up with as we are trying to find ways to use this data to make a change for the women in Ghana. Enjoy your hackathon. Thank you.